are targeted on account of their gender in all realms, and this is a problem faced in all countries and communities, one to which a sustainable solution cannot seem to be found. At present, violence against women and girls exists as one of the most oppressive forms of gender inequality and hinders equal participation in the cultural, economic, political, and social spheres. Thus, violence against women and girls must be successfully combated if society is to truly progress and transform. Today, we are joined by Dr. Nwabisa Shai, PhD, a specialist scientist in the Gender and Health Research Unit of the South African Medical Research Council. She's an honorary lecturer at the School of Public Health at the University of the Witwatersrand and a driver group member of the Violence Prevention Forum. She has over 20 years of experience in gender and gender-based violence, intervention, development, adaptation, implementation, and evaluation research of GBV and HIV prevention intervention. Good afternoon and welcome to the program.
Good afternoon, and thank you for having me.
Thank you. Could you begin by defining the parameters of violence against women and girls for us?
Violence against women and girls involves emotional, economic, physical, and sexual intimate partner violence, non-partner sexual violence, domestic violence by other persons in the family, for instance, as well as other forms of violence that are experienced in childhood, including neglect when we're thinking about girls. But we must also not forget that we have high levels of femicide, which is the killing of women. And this is the most extreme form of violence that is experienced by women and girls. And these forms of violence are gendered, meaning that women and girls are victimized based on the unequal gender norms and relations and power that renders women abusable and at the mercy of men. And we must also remember there's also violence that young girls experience in relationships with men with young men who are around the same age as them.
And then violence against women and girls is undoubtedly an international phenomenon, one which pervades all realms of life and is deeply entrenched around the world to a point of normalization. How do you think that we have reached this point?
We've reached this point because of how we engineer gender roles and position women and girls, and how we keep them in subjugated positions and roles in relation to men, both at home and in the community. And what happens is that these gender roles and positions of men that are oppressive, this takes place in a context where we have high levels of poverty, we have racism and discrimination. And placing women under the authority of men as young girls and young women or as wives is also transferred from the home and the community also into the workplace, in the expectations, for example, that though we have policies that allow for women to occupy high positions, but there's also resistance to women being leaders. And often it results in women being undermined in their positions and being perceived to be unprepared for that kind of work or unsuitable for that kind of work. And we also have high levels of sexual harassment taking place in the workplace as well, which is not dealt with. And we can see also in intimate relationships, research is showing us how male partners also cannot deal with being questioned about their behavior or decisions that they make, and how, for example, culture or religion may often be used to discriminate against women in order to put them down. And the family relations lose out in that setting because one does not foster to have good relations.
Many governments and other institutional forms of leadership have put measures into place to fight against the notion of violence against women and girls. And while these are transformative in theory, there are many gaps and asymmetries in practice. Why do you believe that this is the case?
I think this is the case, and I want to kind of make suggestions about how we can do it. So first of all, we must check who benefits when real change does not happen. It's mostly men and often women who gain some social status or favor with men when they're not encouraging gender equality or gender equity. We also need to be analytical and understand where the violence comes from and not shy away from acknowledging how violence in our country was used to dominate other people, and often also in conflict resolution as a means of conflict resolution, and often just to be heard. We also need to understand well that social and gender norms are bred and shaped within the household first, and as well as in childhood, and that is transferred into the relationships that people have in other spheres of their lives. And we also cannot ignore the structural inequalities in our society, such as poverty and gender inequality. And so our programs must make sure that they are implemented within the ecosystem that involves the state, research organizations, community-based organizations, and development partners. And we must also seek to foster a collaboration and partnership between these organizations, as that is crucial in order for us to be effective in the work that we do to try and solve this problem of violence.
And then South Africa has some of the highest rates of violence against women and girls in the world. How does our country measure up when compared to countries of a similar structure and nature around the world?
Well, it's very difficult to be exact because though we know the levels of violence in our country, can you hear me?
Yes, I can.
So I was saying that it's difficult for us to actually be exact because we lack the national figures for the prevalence of violence against women and girls. But we do have studies that are indicating to us that we have high levels of intimate partner violence. For example, in Gauteng, 51% of women reported having had lifetime experience of intimate partner violence. And we also know that we have among the highest rape statistics and femicide cases in the country. And this is indicative for us that we have a lot of work that we need to be doing and that we need to align our policies in order to reflect our intention to actually deal with the level of the problem that we have. And I just want to add that also COVID has dealt us a big blow in terms of funding for programs and services. And so we need to actually try and work within that context and not be deterred from our efforts to make a difference. And we need to have programs and we need to understand the extent to which COVID is impacting women and children's lives, and women and girls in particular, so that we can try and ensure that we support women to be empowered within a context where lots of families are without income right now because of the economic impact already. And that also increases their vulnerability to violence.
Okay, and then lastly, structural and institutional reform, while rather appealing, are terribly difficult to implement, specifically with regards to violence against women and girls, since much of the abuse carried out takes place in the private sphere. How can this be rectified?
So, like I said, that we need to align our policies with our interventions. We have a national strategic plan on gender-based violence and femicide, and we need to work from that level and see how government policy and also community-based organization policies and interventions, how they can be aligned. But we also need to make sure that we implement programs that are actually known to work well. So we need to be very systematic in how we work to prevent violence, and we need to focus and invest funds on long-term prevention. We need to cut out campaigns because we do not know whether they work well or they don't. But we also need to ensure that we have good psychosocial support services and programs, and to ensure that we keep our systems working very well, and that we do not find ourselves in positions where there's complaints about certain cases not being dealt with properly. At the same time, I want to add that working at the district level and zoning in on what needs to be done will help us to be able to reach individuals, couples, families, and communities more intimately. But that can be a starting point for us where we can grow our plans using these programs that are based on participatory and experiential learning, that are based on sound theory. And we need to start working and delivering programs that we know work well in South Africa, because South Africans can no longer afford to not have the programs and the tools that can help them to prevent violence, particularly women and girls.
Thank you so much for joining us and for shedding some light on the notion of violence against women and girls, an issue which should most certainly be at the forefront of public discourse.
It's my pleasure. Thank you.
Thank you. That was Dr. Nwabisa Shai, a specialist scientist in the Gender and Health Research Unit of the South African Medical Research Council, talking to us about violence against women and girls and what can be done to counter this problem.
South Africa, the refugee camps in Syria, or orphanages in Yemen. The eyes of the needy speak volumes with just one glare. We know what it's like to be at ground zero, with food essentials, clothing and blankets fresh water portal